Hi, I'm Andrea, a level 1 nursing student. I was wondering if you could give me SBAR report on your patient.
Yeah. Hi, Andrea. My name is Chris. We have Shanene O'Connor as our patient. She's a 34-year-old female in room 231. She's a patient of Dr. Engelbert. Her admission was due to a fever of unknown origin. She has an allergy to trimethoprim, sulfamethoxazole. She's a full code. She's allowed activity as tolerated. She reports to the ED with fever, chills, and malaise. She has an elevated blood glucose level, decreased appetite, minimal urine output. She has a history of diabetes for 26 years. She's an end-stage renal failure secondary to diabetic neuropathy and hypertensive nephrosclerosis. She had a graft infection 3 months ago, which was resolved by IV antibiotics, and she has a history of recurrent UTIs. She is alert and oriented ×3. She has an IV in her right forearm, an AV graft in her left forearm, so we're not giving IVs or blood pressures on that arm. She denies tenderness, drainage, or color change to the site. She has a recent weight gain of 10 pounds over 2 weeks. Reports dark concentrated urine of low frequency. Denies pain, burning, or difficulty with urination. Reports numbness and tingling to the lower extremities. She reports decreased sensation. She is tachycardic with an irregular rhythm, or with a regular rhythm, excuse me. She has 1+ pitting edema to her lower extremities with 1+ pedal pulses. She has no further complaints to head, neck, back, torso, extremities ×4. Her temperature is 101.9, blood pressure is 138/78, heart rate 95, respirations 20, O2 sat 96% on room air, blood glucose level was 155 at 7:30. She's on a renal diet with oral fluid restriction of 1,500 milliliters per day. Her urinalysis has resulted showing an elevated white blood cell count. We're closely monitoring her eyes and nose and vital signs. We're to notify the physician of a temperature greater than 101 or a blood pressure greater than 180/100. We're going to titrate her O2 to maintain SpO2 above 92%. We're checking daily weights. We're checking her blood glucose levels before every meal and at bedtime. For now, we will be giving her an antibiotic, and the rest of her medications are available in the MAR, which are not due at this time. Her CBC, CMP, and urine culture are in the lab, and we are waiting on the results. Do you have any questions?
I sure do. Why specifically is this client receiving this medication, and what action does it have on the body?
She has an elevated white blood cell count in her urine and will be started on a broad-spectrum antibiotic pending further lab results to inhibit progressive complications with the infection and possible sepsis. Imipenem inhibits bacterial cell wall synthesis by binding to penicillin-binding proteins. Cilastatin prevents renal metabolism of imipenem.
Okay. I have a few questions in this next one. When should you question administering the medication? Does it have a therapeutic serum level? And what vital signs and physiological parameters should be monitored?
Well, the medication is contraindicated with a hypersensitivity. They can also have a cross-sensitivity with penicillins and cephalosporins. You also want to use cautiously in patients with seizure disorders, renal impairment, and geriatric patients. The medication can increase the heart rate and decrease the blood pressure, so we'll need to monitor accordingly. We'll need to monitor eyes and nose, assess for anaphylaxis, check vital signs, and we'll need to monitor the BUN, AST, ALT, creatinine for kidney function.
Okay. What interventions must be taught to the client to ensure that the medication is administered safely in the hospital setting and/or at home?
We need to pay attention and report any adverse effects and assure that the patient knows what those adverse effects are. And the medication will not be taken at home because it's an IV antibiotic.
Okay. What are the side effects and potential adverse reactions?
The patient can develop seizures, dizziness, hypotension. C. diff is associated with this antibiotic. rash, pruritus, sweating, urticaria, phlebitis, and of course allergic reactions.
Okay. And how will you know that the medication is effective?
When the signs and symptoms of infection subside.
Okay, that's all I have.
All right, thank you. We're going to go ahead and pull the medication out of our fixes. We're going to check for the color, clarity. Check the pharmacy for compatibility. Check expiration date, confirm the order in the MAR. Hi, are you Sinead?
Yep.
My name's Chris. I'm your nurse. Can you tell me your name and birthday?
I'm Shanae O'Connor. I'm 34 years old.
Do you have any allergies to medications?
Yes. Trimethoprim and sulfamethoxazole.
All right, good job. So we're going to give you an antibiotic. Do you know what you're receiving the antibiotic for?
It's an infection.
Yes, you have an elevated white blood cell count, so we're going to give you a broad spectrum antibiotic until your or until your cultures come back. From that point, we can treat the infection more accurately. So for now, we're going to check your IV. Have you had any problems with the IV? Any burning sensations?
Nope.
Any discoloration around the site?
Nope.
Alright. Is there any burning?
Nope.
Alright. Can I see your armband, please?
Yep.
Scan this. Scan my normal saline. Prime my tubing. So that we don't have any ammo on. System on. Turn on the pump. It's the same patient. Med surge. Channel select. Guardrail IV fluids. Giving normal saline. Correct. Saline is going to be infused at a rate of 30 milliliters per hour. We're going to set to be infused at 950 to assure the line doesn't go dry. Label my line, my initials, time, and medication. Document this in the room, document my site, my time. Proceed with the imipenem psilocybin. We're going to give 500 milligrams over 100 milliliters. We have the right dose, right time, right patient, right route, and medication. And you have a right to refuse this medication at any time. Do you understand that?
Mm-hmm.
Now scan your wristband again. Check 5 drops on my normal saline. Prime my tubing for the secondary line. Alright, go to channel select. Go to secondary. Find imipenem psilocybin, 500 milligrams in 100 milliliters. That is correct. Next, we're going to deliver this medication over 1 hour. And clamp. Start. Alright, I'm going to watch for 5 drops. 1, 2, 3, 4, and 5. Alright, so you have your call button.
Mm-hmm.
Alright, do you understand when to notify staff if the this medication becomes a problem. Can you tell me the signs and symptoms you need to look for?
I'm not sure.
Okay. We're going to look for difficulty breathing, signs and symptoms of anaphylaxis, which would include angioedema, wheezing. If you start getting confused, if you start noticing blotches on your skin, okay? And make sure the bed's in the lowest position. And if you need anything, let us know, okay?
Okay.
Wash my hands.
Admitted for observation, a fever of unknown origin. Right. She's a history of type 1 diabetes. She's unsafe.
And I'm going to make sure that this
She had a graft infection about 3
below.
months ago. She's got peripheral neuropathy, retinopathy.
Antibiotic.
She's complained about general pain.
And I'm going to label this
Fever 101. We've given her Tylenol.
initials, time, and medication.
That she's had some relief with that, so we're going to watch her and see how that goes. We'll ask her about that. Her respirations are clear to oscillation. Her O2 sats are 96 on her there. She's got a cough.
All right. So do you have any questions, Andrea?
I sure do. Were there any pertinent pieces of information you reviewed before administering the client the medication?
We reviewed allergies, drug compatibility, and the 5 rights to drug administration.
Did this information affect your decision to administer the medication?
Yes, I wouldn't be able to administer the medication if the client was allergic. The drug was not compatible with the fluids, or the 5 rights were incorrect.
And did this information affect how you administered the medication?
No, because all of the information was correct, so I was able to administer it.
Okay, thank you.